Good afternoon, everyone. Welcome to Staff's Innovation Webinar Series organized by Staffordshire University. I'm Asad. I work within the Department of Engineering. We have a small, tiny mathematics and statistics group within the Department of Engineering. I am part of the Maths and Stat group. At Staffordshire University, I teach mathematics and statistics subjects within the Department of Engineering. Previously, I used to teach for other subject areas as well, but now I am teaching only the Department of Engineering. As part of my job, apart from the teaching side, I am actively involved in research. My research is mainly on the mathematical and statistical modeling, but in the application areas, I do apply mathematical and statistical modelings in healthcare mainly, but at the same time, I do sort of telecommunication research and environmental research as well. But like I mentioned, my prominent research area is healthcare. It started when I started my PhD. During the case study, when I'm going to discuss, I will give a little bit of reflection how it started and what I have done in my PhD. Right. So before I go to the main talk, just a little bit of my background. Well, although I'm working within the Department of Engineering, my background is applied statistics. My first degree is in applied statistics. I did BSc honors in applied stat and an MSc in applied stat. Then I did another MSc in bioinformatics, sort of gene protein things, but still mathematical modeling. Just the domain was biology. Then I decided to work on healthcare for the UK. I got my PhD opportunity at University of Westminster, London, where I have worked with 5 hospitals. I'm going to talk in one of my case studies, so I don't want to discuss at this moment. So here is the plan for today. So I'm going to start with organization of the NHS, and then how the NHS is performing at this moment. And then I'm going to present some of the case studies I have been involved and currently I am involved. These are mostly sort of mathematical modeling, simulation. So you can say these are sort of machine learning and analytics technique. Now these are more popular than simple statistical modeling. Okay, I'm going to highlight some of the obstacles within the NHS, why the NHS is not performing well. Well, some of the views are solely sort of my personal opinion. Some of them are arguable, but let's say when we go there, then we can have a little bit discussion and see what are the hindering factors sort of in NHS digitalisation. Lastly, I'm going to present sort of what Staffordshire University can offer as one of the prominent or growing higher education institute within the West Midlands region. Okay, and end of my talk, I will hand over to one of my colleagues. Phil is going to talk about sort of business case for the university, what the university can offer to the large businesses, small and medium-sized enterprises, and for the collaboration opportunities and funding opportunities. Okay, so that's the plan. So before I start talking about the NHS and digitalization scope opportunities, just I would like to let you know that my colleagues will be keeping an eye on the chat box. So if you have any question at any point, just please put it into the chat box. My colleagues will pick them up, and sometime at the end of the presentation, we will come back to all of your queries and questions. So please feel free to put your questions into the chat box. Let's start with NHS. NHS, we know that it's a very, very complex organization. Too many stakeholders, too many small organizations involved, and it is the 5th largest in the world and number 1 in the UK. NHS is the single tax-paying organization who provides healthcare for the whole UK. In England, we have NHS England, like we have NHS Scotland, NHS Wales, and Health and Social Care Northern Ireland. Now, NHS England provides the majority of healthcare for England, over 92%. So where this roughly 8 to 10% goes, so these are managed by larger companies who sort of provides insurance-based care for their employees within their organization, plus some rich people, they can access the private healthcare. But like we can see here, 92%, which is significant amount of healthcare is provided by the NHS England. Okay, so NHS England provides care for primary care, which is sort of GP care, as we know, inpatient care, which is hospital care, long-term care, which is specialist care like cancer care, diabetes care, plus care for the elderly people like nursing care, home care, residential care. NHS England is also responsible for providing eye care as well as dental care. Okay, like I mentioned, it is a single payment system from the government, and government gets money from general taxation, and they take some money from the national insurance payments to provide money for the NHS. The beauty of NHS is it's totally free. Anyone will have access to the healthcare services provided by NHS England. And the second beautiful thing is free medication for children less than 18 years of age and patients with repeated prescription, like patients having diabetes, having cancer, or other long-term care. Now, if we look at the organization of NHS England, you will see some numbers with some terms like non-specialized trust, which are now referred to as clinical commissioning group, including 84 foundation trust. We have 17 acute specialist trust, including 16 foundation trust, mental health trust, with 42 foundation trust, 35 community provider, 10 ambulance trust, and over 7,000 GP practices. Lots of things. So now if we try to look at how these trusts are organized, then this picture gives a nice sort of reflection how those clinical commissioning group and trusts are hierarchically structured. So if you see at the very bottom, we have 151 local authorities who provide public health services like now the immunization. For COVID, they provide social care for the elderly people. We have primary care networks who provide GP care. We have 77 NHS trusts, including or 150 NHS Foundation Trust. The boundaries between here, the trust and foundation trust, a little bit complicated, but I'm sure many of you are familiar with these boundaries. So just roughly, if we try to say how they are divided, well, the foundation trusts have little more sort of sovereignty. So that's how you can think of how you will differentiate with a pure NHS trust. Okay, so these trusts provide mainly the secondary care, well, the hospital care, community care, and ambulance services. So this is one of the biggest part within NHS, and GP, of course. Right, now these are sort of hierarchically involved within clinical commission group who funds for these small sub-organizations, right? So this is how the NHS England is structured. I'm sure many of you are familiar with this. Now let's talk about the performance of NHS. So I am going to compare with USA first, and then I'll go to the comparison with other European countries. Now, if we look at the expenditure, healthcare expenditure in USA is around 17% of their total GDP, whereas in the UK around 10%. Per capita expenditure, $10,000, over $10,000 in USA, whereas in the UK we have 4,000. Now, if you look at some indicators, you will see some interesting results up there. In terms of expenditure, USA is spending significantly higher than UK. But if you look at the life expectancy, we are higher. If you look at the infant mortality, we are lower than USA. Maternal mortality, we are lower. Mortality from preventable causes, we are lower. Mortality from treatable causes, we are lower. Some of you might argue that, well, it's not a fair comparison. USA is post-Atlantic country and they are more capitalist, whereas we are more socialist. So the comparison is not fair. Yes, I agree. So now let's have a look at how NHS is doing among the European countries. Well, the study is not very good. So this paper published in 2018 based on Health Consumer Powerhouse Survey 2017. So what you can see from here is UK emerges in the 15th place among the 35 European countries. Not very good. Now, if you look at what happened in Health Consumer Powerhouse Survey in 2018, well, things have even got worse. In 2017 survey, UK was ranked 15th, whereas in 2018 it is 16th. So one rank gone down. And the most ironic part is you can see, well, probably you don't mind to see some of these countries there because of, you know, aging population, digital transformation, and many other reasons. Okay, but if you look at here, Czech Republic, Portugal, France, which is a shame for us. NHS is one of our pride. We want to see NHS UK somewhere in the top, not in the middle, not, you know, after Czech, not after Portugal, not after France, Germany. Okay. Well, for Estonia, last year gone one rank, well, above UK. There is a reason, because you know that Estonia has got digital transformation over the last 10 years. Other than marriage, death, and birth, a citizen can manage everything from home. So they are highly transformed through their digital technologies. So, well, some of you might argue that ranking is complex. I completely agree, because the ranking involves tons of indicators. It involves healthcare expenditure, mortality indicator, life expectancy, and most importantly, performances, waiting time in primary care, secondary care, tertiary care, long-term care. So weighting of this factor is an important issue, and then converting all of those indicators, converting into a single index, well, it's complicated. So my point is, whatever it is, but UK shouldn't be here. UK should sit somewhere on the top 5, 6. Whatever the ranking you talk about, we would love to see UK somewhere in the top, within top 5. Right? Now let's have a look at the performance of NHS over the last 10 years or so. Okay, so this is the waiting time at major A&Es within England. So the government's mandate is to provide care anyone attending a major A&E. By major A&E, we mean that those A&Es who provide care for 24 hours. Okay, so government's mandate is to provide care in less than 4 hours, and 95% of patients should be seen by a clinician in less than 4 hours. And if you look at the trend over the past 10 years, well, let's not worry about this part, because COVID started, things have gone very complicated. So even up until here, if you look at the trend, NHS is struggling to cope up with government's mandate. Very similar picture for a diagnostic test. If you look at the trend is increasing, so well below the target. So for the diagnostic test, the target is 99% of the patients should be able to have their diagnostic test within 6 weeks time. Okay, whereas we are somewhere here, so 30% higher. Okay, similarly, if you look at the elective patient for hospitals, the target was elective surgery should happen within less than 18 weeks time, and the government's target is to provide the care within 18 weeks period for over 92% of the patients. Whereas if you look at the trend, it's going down and down. So I don't know where we are heading at some point over the next 2 or 3 years or so, after this pandemic has taken so much money from the government. Okay, right. So similarly, if you look at the first cancer treatment after diagnosed, the target is less than 62 days. 85% of the patient should have received their first cancer treatment in less than 62 days, whereas it is going down. Okay, so at this moment, you can see NHS is providing care only for 72% of their patients within 62 days. Delayed transfer of care is another pain for the NHS. These patients are clinically ready to be discharged, but due to the fact that the residential care, home care, or the family is not ready, well, in some cases, the person is living alone, so it is difficult for the hospital authority to discharge them. So the patients are clinically ready to be discharged, but due to the fact that the discharge place is not ready yet, the hospital management cannot discharge them. And this cost a huge amount of money, around 1,800 million per year to the NHS. So if you look at the NHS performance by the indicators we have just seen, NHS is far away from their target. Well, if you look at the budget over the last few years and the government's target, the budget is increasing. Well, even if you consider the inflation, still the budget is increasing, considering inflation around 0.20%. So still the budget is increasing, but this budget is not able to cope up with the demand and the other challenges. Okay. Now, one of the way to improve the system is the digital transformation. We have seen for other European countries, and for the NHS, yes, we expect that the digital transformation to be happening. If you look at the travel, tourism industry, transport, communication, retail, banking, and other sectors, they have been revolutionizing their setup, their customer care through the adaptation of digital technologies. Deloitte published one of their report closing the digital gaps for healthcare in 2019. They have mentioned NHS is 10 years behind these industries. Okay, whatever the reason, we are not going to concentrate at this point much, but healthcare sector is way behind those sectors. Okay. Now, some of you might argue, well, healthcare has a very complex structure, but still the sector shouldn't be that behind when we have the technology, we have the manpower, we have funding, we have everything. It is just not happening. Well, good thing is government has realized more funding available for the digital technologies. You have seen NHS Artificial Intelligence Lab, government has allocated 250 million, and so many other digital technology things or funding happening within the NHS. Research increasing, but not the way it should have been. It is not. Investments are increasing, restructuring happening through the digital transformation. Okay. Well, things have been going smoothly and we were in a very good position, but due to the COVID, many things has happened and government had to concentrate on COVID care rather than, this digital transformation. But still, we hope that once this COVID is gone, things will get started to be normal again, then this transformation will take place. The central part of digital transformation are, of course, the communication technology, 4G, 5G, but some important things are analytics, machine learning, and artificial intelligence, particularly when you talk about the delivery of the care, or in some cases, clinical procedures like through artificial intelligence, you can think of very smooth and very efficient surgical procedure as well. So particularly if we talk about the delivery and operations in aspects, then digital transformation can play a crucial role. Okay. Now I'm going to go through some of the case studies I was previously involved, but I'll go through very quickly as the time might not allow me to talk much about these case studies, but I will try to show you how the artificial intelligence, machine learning, analytics, statistical, mathematical modeling, simulation technique can provide very efficient solution to many NHS problems, particularly in terms of care process management, delivery operations of NHS. Okay. This case study, when I was a PhD student, that was my project, capacity planning of a neonatal network in London. So in this project, let's talk about some aspects of neonatal care in the UK. So before 2014, neonatal care was sort of less organized, I would say. Each hospital provided care individually. After the recommendation from the Department of Health, managed clinical networks established in 2004 to provide more organized and shared care for mothers and neonates within their catchment area. Now, when we talk about the neonatal care or perinatal care, we talk about 10% neonates who require very specialized care. Okay, out of these patients, 2 to 3% require neonatal intensive care, very expensive care. Nurse-baby ratio is 1:1, and these nurses should have very special training. Back in 2010s, 24 networks have been identified working for England on an average 78 hospitals. So North Central Perinatal Network in London was my part of case study. The managed clinical network was established to provide 95% of local babies within where they live. However, there were so many issues. Still, these issues are going on. Capacity was one of them due to the structure of level 1, level 2, level 3 care. There have been some sort of transfer. You cannot avoid them. However, having some sort of shared care, you can minimize those transfer, and staffing was one of the main issues. So, like I said, North Central Perinatal Network was my case study. So we applied analytical model framework, identify with the random pattern of arrival and random length of stay pattern, how many hospital beds need to be in each of the hospitals within the network. Okay, we have come up with some conclusion that UCLH, which was the level 3 or only level 3 unit within the network, required significant number of bed increase. Other units also required expansion, and we have specified exactly how many beds they need to keep to achieve their 95% target. Okay. Now, the perinatal care in London has been reorganized again. So now they call London Neonatal Operational Delivery Network, LNODM. 27 units are working together to provide the perinatal care for the whole London, although they have 3 clinical oversight group within London, but importantly, they are providing care in a very organized manner. The second project I was involved in, it was recent. The project completed last year. We all know that heart patients worry more than patients having other normal conditions or other conditions. Therefore, the emergency department attendance and hospital admission are much higher for the heart patient than the patients with other complications. Okay, so this 1.2 million Innovate UK project aim to reduce the emergency department attendance plus hospital attendance through some digital technologies. The first one was text messaging service. Second one was sort of online questionnaire based service. The third one was iNavigated community service. I'm not going into much detail. However, our conclusion was through the health management of the heart patient through these digital technologies have reduced significant number of emergency department attendances plus hospital admissions. Okay, and we have compared. So how we compared? We compared with two comparator group, same year without using the digital tool and a previous year. We compared the emergency department attendance and hospital admission. We have to ensure that the patients, those who have used the digital tools, didn't deteriorate their health conditions. So we have checked their quality of life through 4 types of standard questionnaire, and we have found no significant difference among those who have used the digital tool and who have not. Okay, so conclusion was, yeah, digital tool reduced readmission and emergency department, reduced the community care as well. They have improved their self-management, and, well, I shouldn't say they have improved their quality of life. However, they didn't deteriorate, their health condition didn't deteriorate. Okay, so it was a success. The digital tools are now at test phase in our Royal Stoke Hospital. This third case study, we have been doing this research over the last 2 years with Royal Stoke. We have received some funding from North Staffordshire Medical Institute. We are trying to find out some good prediction tool to implement at Royal Stoke, well, particularly UHN Hospital, University Hospital of North Midlands. When a patient is coming to the accident and emergency department, at the time of admission, this tool is able to predict whether the patient is going to be admitted or will be discharged in less than 24 hours. Okay, this tool works sort of okay to other places. In our Royal Stoke, overall accuracy is, well, it is 69%, but we are trying to improve the model by looking at more factors, more clinical, socioeconomic, and demographic factors, and we are trying to implement some machine learning algorithm whether the prediction tool can be improved or not. In one of the slides, when I talked about NHS performance, then we have seen delayed transfer of care when the patient is clinically ready to be discharged. But because the place is not ready, hospital management have to keep them within the hospital, and this cost huge to the NHS. At Royal Stoke, 9% of the patients who are admitted are likely to be detox. Delayed transfer of care patients. At this moment, nationally, there is no nationally recommended tool to identify those patients and not much research. So we have developed a tool which is under implementation stage, pilot stage at Royal Stoke Hospital. We have identified 8 variables like age, gender, ethnicity, national early warning score, IMD decile score, arrived by ambulance, previous admission. These are the important factors to classify whether a patient is going to be detox or not. And we have developed a tool, statistical model based, and the tool is working with overall 70% accuracy, and it is able to identify almost 80% of the patients who are going to be detox, and 69% who are non-detox. That's why overall percentage is slightly low, 70%. Like I said, it is under implementation stage at Rallistock, but at the same time, we are trying to improve the model with that we can achieve over 80% accuracy or not. Okay. This is an ongoing project from the Health Foundation. It is $500,000 project. So I will be overseeing for this project the data analytics and quality assurance side. 20 mental health and secondary care trusts are involved, and 10 ambulance trusts are involved. So we are talking about huge amount of data. Objective is to see the nurse retention and patient safety outcomes in hospitals and mental health care settings. Okay. Embrace, the second project, will also look at somewhat force retention within the ambulance trust and safety as well. Due to COVID, we have adopted 2 more projects within that funding. So how COVID impacted, the two of these projects in terms of what's for retention and reconfiguration, how it has impacted on nurse and ambulance services. Okay. So if we look at what are the challenges, you know that NHS is a very complex organization. Too many sub-organizations or people are involved. It is very difficult. So there are so many challenges to talk about just in 30-40 minutes presentation. You can spend days on talking about particular mental health care, cancer care, diabetes care, or other specialist care, long-term care. Okay. Within this short presentation, you can only concentrate on very high level things. Okay. So demand and capacity challenges are the main. We know that demand is increasing due to the aging population. UK has 18% population who have age 65 plus. Due to the advancement of medical technologies, life expectancy has gone up. Therefore, more complex care, more complex situations are faced by the patients. So patients are having multiple conditions. And if we have looked at the demand is increasing for every single indicator across all levels. Okay. Budget is one of the main issues. The staffing, well, these are interrelated. If the budget can be increased, then you can increase the staff, your performance can be better. Okay. So like I said, the care process within NHS is very complex. There are so many internal and external organizations involved, so many stakeholders, including local and national governments, regulatory bodies, commissioner, provider, supplier, a wide range of end users with multiple different complications. Now, government or the Department of Health, they are providing funds. If you look at Medical Research Council, National Institute of Health Research, and Engineering and Physical Sciences Research Council, all of these are providing funding. But most of these funds are going for clinical research or other researches. A very small amount is going for service delivery and operations for the NHS. So what are the hindering factors? Well, some of them are arguable. We know that insufficient funding, majority of them are clinical or medicine focused, little on service delivery. Since we don't have much funding, we cannot perform huge research on that side. Perception of cooperation and knowledge gap is one of the aspects. If we are talking about even within a specific trust, you have GPs, secondary care, tertiary care provider, they should be interconnected. So the care should be provided in an interconnected way or more structured way, but that's not happening because some of these smaller organizations are sort of autocratic. I don't know if this word is appropriate or not. HCP survey, they have mentioned this autocratic top-down management culture for the NHS within the UK. Right? So now, having said that, we have funding restriction, we have complexities. As a higher institute like Staffordshire University, what can we offer? Well, we can offer a lot. We have paramedics degree, nursing degree, which are highly reputed. So we have been producing huge number of workforce for the NHS, and hence we are contributing to the NHS in a significantly better way. We have a strong tie with local hospitals like UHNM Trust and MPFT. Significant amount of research going on within Staffordshire University with NHS. We have several research groups working in School of Health and Social Care, School of Life Sciences. We have Center for Biomechanics Rehabilitation Technologies. We have Center for Health and Development, which is sort of innovative partnership between Stafford County Council, Stoke-on-Trent City Council, and Staffordshire University. Recently, the university has released some funding with some matched funding and Center for Health Innovation is established. Huge investments going on there in Blackheath Lane at Stafford campus. There are tons of opportunities coming in, and the center is expected to be expanded, and we believe that it's going to be one of the leading healthcare research centers soon. Engineering department has got a strong tie with NHS as well historically, and I'm part of the engineering. So as a uprising higher education institute, Staffordshire University has a lot to offer and has been showing a great promises to the NHS and local organization. We invite large businesses, small and medium-sized enterprises, charities to come and see what kind of opportunities we have. Please have a look at the spots we have. Have a look at the previous projects we have accomplished. We are highly committed. So that's what we invite you. So that's all about my presentation. Thank you very much for joining with me. I hope you have got something and you have enjoyed the presentation. Now I would like to hand over to my colleague Phil, who is going to talk about a little bit on about how Staffordshire University what Staffordshire University can offer and how we can take this forward to have some good things. Over to Phil.
Yeah, thank you very much. That was a really, really interesting presentation. Yeah, so good afternoon, everyone. My name is Phil O'Neill. I'm an Employer Partnership Development Manager within Knowledge Exchange and Innovation at Staffordshire University. I act as a Business Development Manager and Account Manager for a lot of businesses in the Staffordshire and wider areas. And we've basically had a new development at the university called the Innovation and Enterprise Zone in the past sort of 12 months or so, which has become a really exciting opportunity for businesses to engage with us on a range of projects. We've got a lot of different support available to businesses, and I'll go in order of how the slide is laid out. First one is funded support for prototyping and new product development. So if you've got a new idea for a new product or process where you're looking to make a change in the business, develop a new product, enhance an existing one, you can do so using some of our funded support, or it may be that some of your clients or the contacts that you work with within your industry may have similar opportunities in that, and we'd be happy to have a conversation with them if you guys would like to make any introductions. We've also got funded support in terms of transport, logistics and mobility, and that could be an opportunity to get someone within your business for 6 months to help deliver a innovative project within that area. We've also got office space available in our incubation and startup hatchery. So if you're looking for some office space with access to some world-leading facilities, you can get that through the university through very competitive prices as well. The hatchery would have access to all the specialist equipment as well. And then we've also got more training opportunities for businesses through our CPD offering, to our skills and knowledge development through CPD and apprenticeships. So CPD tends to be more short courses, and we've got a full portfolio which is being built at the moment. But these short courses are a great way to perhaps get a flavour of higher education, get an understanding of a particular area, and then they could even lead on to credits for a course in the future. One of them courses being our higher degree apprenticeships offering. So we've got a higher degree apprenticeships offering, which has got a range of courses available, and they are fully funded through business through the apprenticeship levy, or if you are an SME, you can get 5%. 95% funded, so you only pay 5% of the cost, which is a really good opportunity. We've also got access to hiring student and graduate talent. So if you want to bring in a graduate, a placement student, or even a current student on a part-time job on an intern basis, you can get access to that through our Unitemps offering. And a lot of what I've mentioned so far is more aimed towards large employers, towards SME employers, but we have got a lot of support for large businesses as well in terms of KTP applications and Innovate UK bids. So if you are a large employer, please get in touch to sort of see what other support we can offer for you. If I can get the next slide, please, that'd be great. Excellent. Yeah, so the best thing to do to find out more would be to email employers@staffs.ac.uk. Just say you're on the webinar this afternoon and what type of areas you'd be interested in, and we'd be more likely to get in touch with you with more information. If you're not quite sure which area you are interested in, but you still want to hear more, please send an email as well, and we'd be more than happy to have a conversation with you. We can get the Innovation Enterprise Zone brochure sent out to you, and then we can perhaps arrange a follow-up call and to run through the brochure and make sure you're aware about all the brilliant opportunities we've got available for you. If you've enjoyed today's webinar and you'd like to get access to more, we have got more scheduled in. So if you go to staffs.ac.uk/webinars, you can get full access to the offer in terms of the events which we're going to be running over the next weeks and months. Thank you very much for listening. Have you got anything else to add, Asad?
No, I don't have anything. Phil, thank you very much.
Well, thanks, folks.